Now, it's World Blood Donor Day, and the South African National Blood Service says it requires blood now more than ever. It's because the pandemic has brought its unique set of challenges. This year, the organisation focusing on honouring the dedicated donors who are continuing to heed this humanitarian call to donate blood while inspiring others to do the same. Well, let's find out what everything looks like this morning. SANBS Medical Director, Dr. Karin van der Berg. Dr. van der Berg, always a pleasure speaking to you. So just how bad are the reserves at the moment before we talk about the incredible volunteers?
So at the moment, we are not looking too bad. The sad reality is that as we go into each new wave of COVID, the hospital beds get occupied by our really sick COVID patients who do not, in general, have very high blood needs. But what it does do is it pushes out all of our other patients. And so, all the surgery cases and so forth, which do use a lot of blood. So at the moment, we're actually not looking too bad. We're sitting at about 4 days stock, for which we are really grateful. And then on top of that, of course, our donors have been really brilliant over the last couple of weeks, heeding our call to come and donate blood.
How difficult has this been during COVID-19, especially with people who want to donate blood but not necessarily wanting to come out to the various centres? We'll talk about where people can donate now, Doctor, in a moment. But have you seen a drop in those donors, or are you able to at least keep the same number of people coming through the doors, sitting down, donating blood and getting that little cookie at the end?
Sadly, no, we haven't been. In fact, if we look at our donor pool, which we define as the number of people who have made at least one donation over the past year, we actually have, our donor pool has shrunk by between 10 and 20%, depending on which area you look at. And that is really sad, because it has meant that we have had periods of time where it was really difficult for us to maintain our blood supply. Earlier in the year, we had to send out national communication to all of our hospitals, notifying them that we won't be able to meet all of the requests that we get. So it has been really difficult. There's the double-edged sword of people being fearful of going out and, especially in the beginning, coming out and exposing themselves. But more recently, our traditional way of collecting blood, going to the large organizations, being able to go to some of these big campuses and collecting blood, that has completely changed. People are working from home, which means that if we go to the big corporates, their offices are empty. And so our traditional way of collecting blood has really been impacted, as has the way in which we collected blood from our youngsters. At the schools, we can't access all of young people we used to, the same thing at the campuses. So it's been really hard, but I must say we have a brilliant team at the South African National Blood Service, and they have done really well, been very agile to respond to this crisis, and I'm extremely proud of the organisation and of all of our donors.
I think the word everyone's using now is pivoting rather well. Doctor, I want to talk to you about vaccines for a moment, because this question is going to start circulating as we get closer to the next rollout of vaccination, whenever that might be. What's going to happen, and is it currently an issue for people who have been vaccinated for COVID-19? Can they still donate blood? Does that change anything from the donor side? Does it change anything from the SANBS? And do you foresee a point where if you haven't been vaccinated, you're not going to be allowed to donate blood?
So I think firstly, as an organisation, we strongly support being vaccinated against COVID. We know that this is the only way to get our country, our economy out of the crisis that we are in. We also know scientifically that these vaccines work and that they are safe, significantly safer than getting COVID. So firstly, as an organisation, I think that is a very important statement for us to make. Secondly, in terms of coming to donate after you've had the vaccine, as long as you're feeling well and you're not having some of the flu-like side effects that we sometimes see, you can come and donate almost immediately. And so there's no problem with that. We don't prescribe to being, or we try not to be descriptive in the way that we deal with our donors. And so as long as you are well and you're not having any symptoms of COVID, and you haven't been exposed to somebody that has had COVID in the last 14 days, we will accept you. I think it's perhaps, if you don't mind, also an opportune time for me to say that we don't in any way mark the blood to say that this blood had been donated by somebody who were or were not vaccinated. And so, there's a lot of people who have raised concerns about receiving blood from people who have been vaccinated. And so from our perspective, we will have one inventory of blood, and we won't know, and the doctor won't know whether or not the person who donated that unit of blood had been vaccinated or not.
Doctor, I'm actually out of time, but I think this is an important question. You just made me think of it. Just in 30 seconds, if you can, I just thought of this. What happens if someone has had COVID-19, but they have recovered, they are now in the all clear with everything you just mentioned? If you've previously had COVID-19, but you're in the clear, can you donate? 30 seconds, ma'am.
Yes, you can. As soon as you are well and you have not had any symptoms for the last 14 days, we will open you with welcome arms, and we would love to have you anytime.
Well, I appreciate your time in speaking to us this morning. All the best with World Blood Donor Day. The call for anyone who can and is willing to come out and donate blood. Yes, we're all looking after ourselves as well, of course, but lots of other people who also still need to be looked after. What a pleasure. Dr. Karin van der Berg, Medical Director of the South African National Blood Service.